How to diagnose dengue. A blood test is usually recommended if a person has a fever, muscle pain, weakness, or any other symptoms of dengue. A lab test is the only way to confirm dengue infection. However, the type of dengue test used may differ depending on the time of infection and the appearance of dengue fever symptoms. Before considering a blood test for dengue, you should be aware of the various types of blood tests available. Dengue testing is classified into two types. A. Direct tests. These are tests that identify the virus based on its antigen or genetic signature. These include an ELISA-based non-structural protein 1 (NS1) antigen test and an RT-PCR-based dengue PCR test. Both tests are 99 to 100% specific, with the latter being more sensitive. B. Indirect tests. These are tests that look at how the body reacts to the virus. These include IgM and IgG antibodies measured by ELISA against the dengue virus. Here's a quick read that will walk you through the various tests recommended to detect dengue infection. A. Direct tests. 1. Dengue NS1 antigen. This test is used early in the course of an infection, usually within the first 5 days of symptom onset. This is because NS1 antigen appears on the first day of dengue infection and can last for up to 5 to 7 days. Following that, it begins to disappear from the body, indicating false negative results. 2. Dengue RT-PCR test. This test is also used to detect dengue virus in the early stages of infection, the first 5 to 7 days. It detects the viral genome, the virus's genetic material, in the blood. This test is approximately 90% sensitive and 95% specific for the infection. This is the most sensitive and specific test recommended in the early stages of an infection. The dengue PCR test should be performed within 5 days of the onset of symptoms. B. Indirect tests. 1. Immunoglobulin M (IgM) test for dengue. This test detects IgM antibodies in the blood, which appear early in the disease and indicate acute or recent infection. If you have dengue symptoms that last longer than 5 days, you should get a dengue antibody IgM test. It is usually done after the 4th day of the onset of symptoms because antibodies begin to develop after 4 to 5 days of infection. A dengue PCR test and NS1 antigen are recommended within the first week of symptom onset. A combination of NS1 antigen/PCR and IgM antibodies is recommended between the 3rd and 9th day. 2. Immunoglobulin G (IgG) test for dengue. Because the level of IgG to be monitored in the test tends to increase slowly, it is used to detect infection in the later stages of the disease. IgG antibodies are typically detectable in low quantities for 14 to 21 days after infection, after which they gradually increase. These antibodies can be found in the blood for up to 90 days and, in some cases, for the rest of your life. 3. Complete blood count. Dengue fever is frequently associated with a low platelet count. As a result, the platelet count should be carefully and regularly monitored, especially when the fever subsides. If a patient tests positive for dengue-specific antigen, his or her platelet count and total white blood cell (WBC) count may decrease. However, it is critical to understand that the diagnosis of dengue does not rely solely on platelet counts. If this video is informative for you, then don't forget to like, share and comment. For more health-related information, subscribe Medphox. Thank you.